In this video, I want to talk about drugs to treat diarrhea or antidiarrheal agents. So one important drug class are opioids. And we all know that opioids can cause constipation by stimulating these mu receptors. And so we can use opioids also to treat diarrhea. Now, obviously, we don't want to have the central effects of opioids, so we are using peripherally restricted opioids. And one famous example is loperamide. So we don't want central opioids effects when we're just dealing with diarrhea. So there are some options out there to use opioids that are not affecting our central nervous system. Loperamide is one example. It actually passes the blood-brain barrier, but it is a substrate for a multi-drug. Loperamide is actually passing the blood-brain barrier, but it is substrate for P-glycoprotein, and it's going to be pumped right back out again. So it's going to not have central effects. So there's no abuse potential, also no danger of a respiratory depression and all these severe opioid adverse effects. So that's loperamide. Another example is diphenoxylate. And this one actually passes the blood-brain barrier. And to just prevent abuse, it's always formulated with atropine, because atropine is an antimuscarinic, has as an adverse effect blurred vision, constipation, dry mouth, urinary retention. So not very comfortable. Therefore, it's combined with atropine. So if you use too high doses, that there is significant CNS effects. So these adverse effects are going to kick in and make taking this drug not pleasant. And so just to remind you, how do these opioids work? Well, if you stimulate the mu receptors, so these are mu agonists, peripherally acting mu agonists, and if you stimulate the mu receptor, you're going to increase the mixing movements in the bowel. So you're going to mix forever, and that's obviously leading to constipation, and that's good as an anti-diarrheal. And you're also going to decrease the contractions that move the bowel content forward. So you have a dual action, one time mixing forever, and then also less of this forward movements, and that's why they lead to constipation, which is good as a treatment for diarrhea. As adverse effects, you can get some abdominal pain and cramping, and obviously also constipation, cramping, and constipation. Of the other end of the spectrum here. The only other drug I want to mention in terms of anti-diarrheal agent is cholestyramine. That's a bile acid binding salt. So it binds bile acids. In some instances, our body may have too many bile acids. So this is used for bile acid induced diarrhea. How could you have too much bile acid in your bowel? Well, for example, if you had an ileal resection, where you remember the bile acids are always taken back up and are recycled in our terminal ileum. So, for example, you took out the terminal ileum, or you have Crohn's disease, there's no way to recycle them, and then you're going to have them all in your lumen, and bile acids are also secretory, so they're going to induce secretions. There's also they're osmoles, they're going to draw water, and you may end up with diarrhea. In this specific case, you can take drugs that bind bile acids, and one famous one is cholestyramine, a bile acid binding salt. So only used for diarrhea under specific conditions where the diarrhea is caused by having too much bile acids. Another important take-home message for these drugs is also the not only bind bile acids, they're also fairly unspecific. So in the end, they bind to everything. And so if you're having a patient that is on other drugs as well, you need to make sure that there is some distance
In time.
to taking the other drug, because it's going to bind all the drugs, and you're going to have a lot of drug-drug interactions just by binding them and making them unavailable. Drug-drug interactions. I think that's it for the antidiarrheal agents. So the important ones are loperamide, maybe the diphenoxylate, and then we have the cholestyramine for the very specific indication of diarrhea caused by too many bile acids. This finishes up the video on antidiarrheal agents.